So I now would like to kind of hand this over to our two pediatricians, Dr. Relosa and Dr. Posse, to share a little bit about your experiences with parents, as far as questions that they might have, and what do you think is the most important point to share with parents about the COVID-19 vaccine for kids in this age group? So Dr. Relosa, if you be willing to respond first.
Sure. Obviously, as a pediatric infectious disease doctor, I've been approached for a lot of things during the COVID pandemic, and really, what hits close to me is when we start talking about this age group, and especially preventing disease and helping. And I think what a lot of the focus has been, even for those parents who have gotten vaccinated themselves or had their older kids vaccinated, when it came down to this age group, I think because we view our younger children as maybe a little bit more vulnerable or not having as much information, it's really become a big sticking point. In addition to what you pointed out, Dr. Rattay, that a lot of people have this feeling that these younger kids have not been as affected or severely as affected as older kids or parents. And I'm glad you shared with us those slides that really, I think, it needs to be pointed out that COVID-19 has affected everybody at all ages. And while the numbers might be different relative, there is no one who has not been affected. And for all of us to be able to make our way out of this pandemic, it's going to be taking an effort and interventions for all ages. I think the other important thing to say is that to answer some of the questions is that again, people felt like this had been rushed in terms of the vaccine, but I think it's important to point out the same vetting process that we used for other medications and vaccines in children is the same process that we used here for the COVID vaccine, both for adults, the older children, and our 5 to 11-year-old. And so we should have faith, we should have trust in terms of the process that these have gone through, that it's been vetted at multiple levels, that we're making sure that we're providing a vaccine that is not only effective in terms of preventing disease, but also really safe for our children. No different than most of the other vaccines that we provide on a daily basis to children of all ages.
Great, thank you. And Dr. Posse.
Yes, great. Thank you so much again. So to follow what Dr. Relosa has said, so from my perspective, I'm a primary care pediatrician in the community. So I have the great fortune to take care of children of all ages from, a couple of days after they're born until some I get to see to their age 22, which is great. And and I also take care of children that are coming in for a well child visit, their annual checkup, kids who are, sick, and children who may have chronic illnesses. I may support the specialist in that as well. So again, I'm seeing the wide range of children. And then also in my role at Henrietta Johnson, I'm also the director of public health programs. So I've actually been able to work with our entire community when it comes to managing and treating COVID-19. So that's an important perspective that I have is I see children clinically, and I work with all families, and families that include grandparents, parents, aunts, cousins, etc. So what I think is really important that I actually been really impressed by parents is asking the question. I think that's very, very important, right? We want you to have the information. We want you to engage with your pediatrician, right? I want to educate you with the accurate information and scientific information. Then I want to empower you to make the right decision for your child and also for your family's health. So common questions that are asked is, what's different about the COVID-19 vaccine? I think Dr. Relosa alluded to that, is that I think first, what's foremost important is that the vaccine is a vaccine, right? So it's going to help protect against a viral illness or a bacterial illness. The difference is that the COVID-19 vaccine is specific to the COVID-19 virus, right? So in that same way, it goes through the same clinical trials where we see how that is, how the vaccine will work on adults and then adolescents and then children, and then it's also given in the same way. So, for parents who do vaccinate their children, again, I see children are vaccinated in the newborn age, when they're going off to school, whether that's kindergarten, whether that's middle school, high school, or even college, for getting your same routine, childhood immunizations, as we call them, would be the same way as you get an annual flu vaccine and now the COVID-19 vaccine as well. So that's really where I start with parents is let's start with, you're very familiar with vaccines, right? Whether that's you holding your child before they get their shot, right? Asking the pediatrician questions. So let's speak more about the COVID-19 vaccine specifically. So that's where I've really engaged with parents. And of course, the common questions are, will there be any side effects? What are some long-term side effects? And I think what's been really great for us to see is that, again, the clinical trials have been very, very promising. Side effects are very similar to any other vaccine, whether that's your tetanus vaccine, your meningitis vaccine,